Should we be feeling about this relatively small but significant outbreak?
Good morning, Paul. I think we need to be alert to the disease and ensure we can deal with it via our public health system, but we shouldn't be over anxious or panic about this. As you said, the numbers are very small, 20 cases so far. That compares to around 1 million people with COVID at the moment in the UK. So very small numbers. So be alert, but don't be over anxious or panic about this.
Sporadic cases of monkeypox are rare, but they're not new in Britain, are they? Just explain to us what process is currently underway to identify where those cases currently are.
So as you mentioned it, we have had cases previously in the UK, but not as many as the current number. So this is more than we would normally expect. Now that we've got travel resuming after the pandemic, we will see more cases of infections being reported into the UK from elsewhere. So that that is not unusual to see. The first step is to ensure that medical staff are aware of the disease, know the symptoms, know what the rash looks like. That has been done by the government. So the government has information out to all health professionals across the UK to ensure they know about this. We need to ensure we can identify cases, test them quickly, put them into quarantine if they are positive or suspected to be a case, identify their contacts, and if need be, test those people as well and put those people into quarantine as well. So there are steps underway to control the disease. We've also secured some smallpox vaccine, which can help protect against infection from monkeypox, even though it's a separate vaccine, and we have some supplies of that which can be used, for example, for healthcare workers or for close contacts cases if needed. So we have got measures in place to limit the spread of infection.
Obviously, this is nothing like COVID, but the way in which we've dealt with the COVID pandemic has that made us more tooled up, for want of a better phrase, to deal with this monkeypox outbreak?
I think we are better placed because of COVID. We realise the importance of things like contact tracing, for example, testing. So I think we are better placed than we were two years ago when the pandemic first starting in the UK. So we can now contact trace better because we've strengthened that system compared to 2 years ago. So we are better placed because of COVID to pick up and suppress outbreaks like this.
And just give us the real basics. How's it transmitted and what are the symptoms?
So the most common way of spread is via animals. So spread amongst people is quite unusual. So this is unusual to have this pattern of spread from people. So it starts like other viruses with symptoms like a high temperature, headache, aches and pains, tiredness, swollen lymph nodes. Then later on, the rash that's typical of the disease appears. So it's a very typical rash, not like any of the rash you might get from other infections. So those are the main symptoms. Most cases are fairly mild and will resolve without treatment, but occasionally it can cause some complications and lead to more severe disease.